Hello, Growing Kids family. Dr. Christy Lane in the house. Did you like the news music? I thought it was amazing. All right, so we have some housekeeping to do for our Growing Kids family, and I just applaud all of you guys on being so amazing with all of the changes that have happened here. It's ever changing week to week. I feel like with this amazing COVID that has invaded our lives. So we're gonna get through this together, and we're going to be patient with each other, show each other a lot of grace, and keep each other safe. That's the goal here. All right, hours, I know, can be very confusing for you guys. They will change depending on patient volume. Right now, we're doing a lot more checkups. We have fewer sick. But as we roll into the summer, we know we've got to get these kids vaccinated, especially the big kids that we've kind of been pushing off, and get kindergarten shots, because we don't know what school year is going to look like next year, and we want to get all these kids protected. So that's one thing. Keep up with our Facebook. We will tell you what the hours look like. As of right now, we're just doing 9 a.m. to 3 p.m. Okay? We take 12 to 1 to eat lunch. And I want to just let you guys know that this 12 to 1 is very important for us, because this is where we regroup, where we go over the day, and where we talk about things clinically, share with each other new information regarding SARS-CoV-2, and educate each other. So we're not just here eating bonbons. What we're trying to do is protect your children as well as our staff. So if you need to pick up a prescription, we recommend, like for medication or paperwork or whatever, we recommend that you come between the hours of 10 and 12, and then 1 and 3. The reason why is because everybody knows if you've called here in the morning, it's chaos. From 9 to 10, the phones just ring off the hook. And so it's going to be much easier for the staff to pick those prescriptions up during those times. The other thing that I want everyone to understand is that our staff is still limited. Not all of our Growing Kids staff is back, okay? Because we have decreased patient volume. That means we're working with more of a skeleton crew. That means a lot of duties are falling on staff members that maybe weren't their duties to begin with. And so just we ask for patience regarding things like referrals and testing, scheduling testing, things like that, because, you know, we're working with hospitals that aren't 100% sure of what they're doing. We're working with other doctors that are still not sure what they're doing, and because this is ever evolving, and so things can change, but we're working hard to meet those needs for your kids. So we are seeing babies up to the age of 2. So babies up to the age of 2 in our morning hours. Therefore, we're protecting our smallest and our most fragile patients during those times. Okay. We also are doing telehealth in the morning if we have that availability. From the afternoon, we're now going to start doing checkups from 3 years of age up to 11 years of age. We're trying to do opening in smaller groups, so that way we're not overwhelmed with bigger kids. Because one of the things we're seeing is that bigger kids are more apt to carry COVID and spread COVID like adults. And we just don't have enough data on kids right now, young kids, to know what's going on in terms of the transmissibility of COVID. So that's why we really want to try to keep under 11, up to the age of 11 right now. And then coming June 1st, we're going to start doing in the afternoon teenagers. So 3 and over in the afternoon, all the way up through the teens, and then some of you college kids that we so love and don't ever want you to leave us. If you have a mask, please wear it. It's respectful to the staff as well as to other people. We do not require a mask though, and but masks are a sign of love for your fellow man, not a sign of weakness or a sign of the fact that I'm giving in to the big government. We all wear them to protect each other, okay? Our office policy in terms of bringing patients in our waiting room will not change. Probably not for a really long time. So when you come, you need to make sure you have a working cell phone so you can call. That is for anything. You have to call. Don't come up to the door We're not going to open it. This is for the safety of everybody. Call from your car. Let us know you're here. Then we'll get you checked in. And then one of the wonderful nurses MAs will come out to the car with their little board and come and get you and bring you right back to a room. Therefore, we've minimized any exposure that you might have with other children, other families, other adults, and also the staff. All right? We've talked about staff being limited. We've talked about studies being ordered. Okay, sick. We are not doing any consults or any sick patient visits in this office. We have not since the beginning of the SARS-CoV-2 epidemic or pandemic. So your needs of your children will be met. You will call, we'll either do a video conference or we'll do a phone conference with you, and then we go through and triage and decide, do you actually need to be seen? If you need to be seen, we will see your child. We do not want to see your child. So like yesterday, I had a row of cars and we see it in the garage. Yes, we have a drive-through, so it's amazing. But this is because we don't want to bring any sort of unnecessary exposure into our waiting room, into our well child exam rooms right now. All right, and this is going to go on indefinitely. I do not know when we're going to let up on our sick, but it is important because we need to protect each other. In terms of this office, we strive to do the best we can with screening. Screening is very important because we understand that COVID manifests differently in different people. We are seeing that asymptomatic people have high viral loads, especially those that are pre-symptomatic, like a couple days before they start developing symptoms. So you might not know that you are infected with COVID. So therefore, we ask these questions, and we don't mean to do it to prevent you or your child from being seen here. But these questions are important because if we bring someone in here that is a possible risk, then that could affect children that are here that are immunocompromised. Some of our staff are high risk. So we're just trying to be protective of everybody. So questions we're gonna ask you, we're gonna go through the litany, and these girls can rattle the stuff left like this. Me, I'm just gonna get through it. So we're gonna say, has anyone in your household, so you, dad, grandma, baby brother, baby sister, anyone in your household had the following symptoms in the last 2 weeks. So you're gonna have a little paper like this. So cough, fever, diarrhea, chills, headache, rash, wheezing, stomach pain, shortness of breath, difficulty breathing, muscle pain, sore throat. Holy smokes. Probably a headache too. Did we put headache on there? Yeah, headache. Okay, I already said that. All right. Then we're going to ask you, have you or anyone in your family been to an urgent care, ER, hospital, nursing home, or rehab in the past 2 weeks? Right? And then we're going to have you sign this thing. The reason why is because this is liability. Because if I let a patient in here that is COVID positive and I infect my staff, or I infect a baby, or I infect an immunocompromised patient, that's a liability. And not only is it a liability, but I've taken an oath as a doctor to do no harm. And this right here helps us to understand that we're doing no harm, and it helps you to understand we're doing no harm. We will ask, though, if you have answered these questions and they are not truthful, you might be asked to leave this practice. So we have dismissed some families because of this, and we take it very seriously here. What else? We are not doing COVID testing still, but we have tested patients for COVID using the health department. I just want you to understand that we have a very good relationship with the Floyd County Health Department as well as the Clark County Health Department, and we can get your child tested if need be, okay? And we will let you know also through the telehealth visit or on phone triage if we feel like your child is sick enough to go to the ER. So what else? That sound pretty good? I think it sounds pretty good. All right, so Growing Kids family, we love you. We care about you. We're getting through this together. And I wish let's see, could I put my news music on? Probably not. But anyway, Dr. Lane signing out. Oh, wait. What do I always say? Wash your hands, wash your hands, wash your hands. Social distance. We're going to flatten the curve. Wear your mask over your nostrils. And love you, peeps. Bye.